Hello. I hope you are all staying safe and well this summer. I'm Dr. Susan Bassett from Eastern New Mexico University in Portales, New Mexico. I have also achieved some other titles during my career, such as Air Force Retired Colonel Bassett or Soldier, Nurse Corps Soldier Colonel Bassett, even author Suzanne Bassett. Of course, Dr. Bassett does apply. I received my PhD in 2017. I could be called Rancher Bassett or simply Nana Bassett to all these children. All these names represent who I have become over my lifetime. It's been a wild ride, quite an adventure, living in 17 different places, traveling the world around. But if you have been paying attention, none of these titles so far has included teacher. Yes, now I am an instructor at ENMU in the nursing program and loving every minute of it. So you might ask, how did I end up being a teacher? Well, it was actually quite by accident, but not without an entire lifetime of preparation. That is why I am so dedicated to education, whether it means specific classes and training or whether it's reading and a general self improvement. So let's start by taking a look at how life could be if you didn't care to or have the opportunity for education, maybe even not to learn to read or write. In 2007, I was an Air Force chief nurse working at the Barksdale Air Force Base Hospital in Shreveport, Louisiana. I responded to an email for a chief nurse mentor for the AFGANA, a 15-month deployment. Little did I know that AFGANA meant that I would be working with the Afghan National Army, their nurses, taking care of their soldiers. The Army Corps of Engineers had just built uh, 4 50-bed hospitals scattered across the north, south, east, and west of their country. So now they needed medical professionals to help the Afghans learn to do modern care and to use their equipment. So after 3 months of rigorous field training with the Army, I was sent to an outpost near Kandahar city in the southern region of Afghanistan. There we lived and worked with the Afghan medics in what turned out to be a ferocious and very dangerous war zone. That all seemed straightforward until I figured out that the 30 men who were assigned to my hospital as nurses could not read or write. They had about 3 months training to be nurses. Their idea of being a nurse was to do whatever the doctor tells them to do. They could wheel patients to the lab or x-ray. They could start IVs, change bandages. They could put oxygen on or even suction a patient. But that was about the extent of their skills. So what did they do that the modern nurses around the world do? They did not bathe, turn, or do any hygiene for the patients. That was expected of family members or servants. But in an army hospital setting, those people were not available. So it just didn't get done. These nurses did not do any patient teaching. They did not exercise or do any therapy with the patients. And they could not document anything in the patient's chart because remember, they could not read or write. These nurses could not pass out uh, medications because, again, they couldn't read the medication name. They could hand out sacks of pills, excuse me, twice a week that the pharmacists put together with slash marks on the outside of the sack so that the patient would know how many pills to take. They set these sacks by the patient's bedside, If the patient was unconscious or couldn't reach his set, well, then it just didn't get done and he didn't get his medications. So I started out slowly, trying to respect their culture and their style of professional work. But alas, spring is the time of year when the fighting picks up in that region and the casualties started pouring in. You can see me there in the bottom picture wearing a blue jacket. The fellow in the middle of the top left hand picture was the chief nurse who I worked closely with. That summer, we had 8 mass casualty incidences. One day alone, we received 49 patients in our 50-bed hospital. You can see in some of these pictures that we had housekeepers even in the blue outfits there, caring for patients who were lined up on stretchers on the floor, waiting for surgery. Thank goodness we had recently given them anesthesia to use in their surgeries. And by the way, the picture in the middle there, with all the blood on the floor, that was their anesthesia guy putting the patient to sleep before they started their surgery. The blood on the floor was the last guy's blood. The recovery room was only a slight step up. We had no reusable equipment or sterilization capabilities. The only blood we had to give was what other soldiers had just donated right on the spot. No one could read, so the doctor would just count the number of empty bags of IVs or blood that were thrown beneath the stretcher to understand how serious the patient's condition was. The top picture here is of a young man who no longer has either of his legs. What you see is all there is. The lower picture with the badly burned individual was, unfortunately, a very common event. And then on the bottom left, with me there again, is a 12-year-old boy who was caught in the crossfire of the shootings. He did not survive. His uncle and his father arrived in a taxi with a casket in the back seat to take their beloved patient home. In the fall, when the fighting died down, uh, I was ready to put my teaching plan into place once again. I had a 36 module outline as you can see in the slide here, of what I could convey to their level of learning. You can see the topics were very basic and mostly just how to use their supplies and equipment. My requirements for each teaching session were the modules were 20 minutes or less of learning, short little sessions, since these men had never learned how to sit in a classroom and actually study something. I supported my talk with a good interpreter and with PowerPoint slides. The pictures on the slides had to convey the meaning, as the men couldn't read the words. I used enticements, small gifts such as suckers for suction day, bottles of water, or pencils if they showed up for training. We used a star chart for attendance. Since they wanted to be seen as educational experts, no one wanted any holes in their public report. I utilized treats like biscuits, the British word for cookies, uh, to go along with their chai time. This training plan was adopted nationwide. I believe the reason that it was popular was that it fit in their culture. It was geared to the equipment they used and the tasks that they were now expected to handle. And most importantly, it supported their desire to be seen as respected, educated professionals. Even though the student in the top picture there had fallen asleep, and the fellow at the bottom of that picture had his feet up on the table resting. These men were becoming known as educated professionals in their community, even though they still could not read or write. After returning to the U.S., I was reassigned to the Air Force Medical School in Wichita Falls, Texas. I learned a very different structured type of teaching with strict learning objectives and focused scientific based content, multiple evaluations of what had been learned and or what could be performed. Towards the end of my career, I was assigned to head the training department at the Air Force's largest hospital located in San Antonio, Texas. Tracking all the continuing education needs for 8,000 medical personnel was no small feat. When I retired from the military, I found my current position as an instructor in both the online BSN and MSN nursing programs at ENMU. My students are all registered nurses coming back for further education to support the advancement of their careers. These students are all very busy nurses, respected professionals in their communities, with their schoolwork being woven in between work schedules, community and church obligations, and family demands. This was an entirely different type of teaching than anything I had previously seen or done. It required delivering an entirely different style of education. But where are the similarities between the Afghan medic teaching, the on the job U.S. medic performance and training, and these online upper division nursing students? They all involve medical education, a subject content that was always familiar to me. The expected outcome always remained that students would provide safer and improved patient care. All three situations involve me, the teacher, needing to understand the difficulties of wherever my students were in their life situations and giving my students the respect of furthering themselves and their educational achievements. And lastly, I needed to know how to motivate my students' desire to learn. Education, no matter what the topic or what the level, is always important. We should all cherish every opportunity we have to progress in our education over our entire lifetimes. Teachers need to be mindful of how to offer that education in the most expedient, flexible, personally rewarding ways possible. For me, that will mean continuing to offer the flexibility of online classes, along with the personal touch of knowing and communicating individually with each student about their learning challenges and successes. Before we end, I would like to tell you a little bit more about ENMU's nursing program. We have both an RN to BSN program, so nurses can get their bachelor's degree, and we also have a master's program, MSN, that specializes in preparing nurse educators. Full-time students can finish either program in about 16 months. Let's look a little closer at the BSN program. There are 14 upper division, junior, and senior level courses. The costs are the fourth lowest in the entire Southwest at approximately $12,600 for New Mexico residents. Most of our students take 2 to 4 classes per semester. ENMU's master's program has 12 courses, including both nursing and education courses, and costs about $11,700 for New Mexico residents or part-time students from other areas. Lastly, and perhaps the very best news, is that ENMU programs give out over $100,000 in scholarships every year, making a huge dent in that bottom line cost for students. Personally, I think that between the low costs and the personal touch that a small program can give to each student, that ENMU is a great way to get your education. If you're not yet a nurse, I would recommend enrolling in a local community 2-year nursing program and then definitely finishing your degree or degrees with ENMU for a full and rewarding career as a registered nurse. Thank you again.